So today I will be assessing her abdomen, kung may ano ba siya, kung may abdominal pain. Kung gano'n is i-refer na natin siya sa doctor. So first, of course, I will be introduce myself to my patient. So good morning, ma'am. I'm Aliyah Faye Aputak. So I will be your nurse for today. So I will be assessing your abdomen. Next is the two identifiers. So what is your name, ma'am?
Age po.
So, kailan ka po pinanganak? Date birth po?
November 4, 2006.
So, next na gawin ko is perform hand hygiene. So, assuming that yung mga gamit ko is nasa side table. And of course, I will be gather equipment. Of course, we will need ruler to measure, mamaya, pang measure, pen, stethoscope, of course, bell and the diaphragm, pillow, and a blanket. So, next is history taking to my patient. So, tatanungin natin siya kung ano, may sakit ba siya sa abdomen. So next is I will be explain the procedure to my client or patient para maging aware siya. So, ma'am, I will be examining your abdomen. So, medyo expose po natin tong abdomen mo. And then, I will provide privacy naman po so that hindi naman po nakakahiya sa inyo. So assuming is saka gawin po yung patient ko. So, of course, we will need pillow sa paa niya. Okay, ma'am. I will assist you. And a blanket. So, and then, I will be exposing her abdomen. Okay. So, of course, we need to ask our patient if, ma'am, umihina po kayo? Okay? Kasi mas maganda pag empty na po yung bladder niya. Para po mapalpate po natin ng mas magaan at mas mainam. So, first, of course, we will need to inspect her skin in the abdomen. So, inspect the skin, noting color, vascularity, stray, scars, and lesion. So, to inspect, mag-wear po tayo ng gloves. So, her abdomen naman is paler than general skin tone. So, wala naman pong vascularity, walang stray, walang scars, and lesion. Is I will be inspecting her umbilicus. I will note the color, location, and contour. So, her umbilicus naman is similar to the skin tone. So, next is I will be inspecting her abdomen contour. So, her abdomen naman is flat and round. So, or ito yung scaphoid abdomen. So, next naman is inspect or look for the symmetry of the abdomen. So, okay, can you exhale? So, okay. So, her abdomen naman is symmetrical. So, next is inspect the abdominal movement. Noting respiratory movement, aortic pulsation, and of course, peristaltic wave. So, her abdominal respiratory movement naman is seen, especially sana to sa mga male. So, okay lang naman. Nagising ko naman. And, may slightly pulsation naman. So, overall, normal. So, next na gawin naman natin, pagkatapos ng inspection is auscultation. So, we will ausculting the vowel sound, noting intensity, pitch, and the frequency. So, of course, I will place the diaphragm in the right lower quadrant. Dapat pa-clockwise and dapat 5 minutes per 5 minutes every quadrant. So I will be starting in the right lower quadrant and pa-clockwise dapat. Okay? 5 minutes dapat. So assuming na 5 minutes po ito. Okay? Right lower quadrant, right upper quadrant, left upper quadrant, and then Lastly is left lower quadrant. So, intermittent naman, soft clicks and gurgles are heard sa abdominal ng aking patient. Okay? And at a rate of 5 to 30 per minute. This is I will be ausculting the vascular sound or the friction rub. So of course, ang gagamitin po natin dito is yung bell ng stethoscope. So, para marinig yung sound. So of course, okay, I will begin. So, brutes are not normally heard and over abdominal aorta or renial or iliac or in the femoral arteries naman. So, walang brutes na naririnig. So, it's normal. So, next na gawin ko naman is percussion. So, we are done in inspection, auscultation, and now, percussion naman. So, I will be percuss the abdomen of tone. For tone, so of course I will lightly and symmetrically percuss all quadrants. So, okay, I will percuss all quadrants. So, normal naman because tympani dullness is heard over the liver and spleen. So, it may also be elicted over a non-evacuated descending colon. So next is we will be percussing her liver. So, I will be use a pen, ma'am. At medyo susulatan ko po. Is it okay for you, ma'am? Okay. So, of course, okay, I will be percussing her liver. Okay. And sa baba po, mag-percuss ulit tayo. And i-measure po natin. So, the lower border of liver dullness is located at the costal margin to 1 to 2 cm below. And on deep inspiration, the lower border of liver dullness may be decreased from 1 to 4 cm below the costal margin, and the upper border of dullness is located between the left fifth and seventh intercostal spaces, and the normal span at the MCL is 6 to 12 cm. So, greater in men and taller client po yung mga ayon. The normal liver span at MSL is 4 to 8. So, dapat, pag pinasalkas po natin, sabihin po natin yung patient natin na mag-hold breath or inhale, ganon. So, sinabi ko naman na po kanina sa kanya, hindi lang po naisali sa video. Of course, pepercast po ulit yung midline niya ulit. Midline po. Of course, yung dati naman, magsusulat po tayo. And, okay, measure. So, may isa pa pong method dito, which is yung scratch test. So, gagamit po tayo ng stethoscope again. diaphragm, of course, and ilalocate po natin siya sa liver, of course. It is useful sa abdomen. Useful if the abdomen is tense. So, sa pag-perform po ng scratch test is place the diaphragm of your stethoscope at the second to the last intercostal space dito. And then po, is mag-scratch po tayo. Use finger very slightly, stroke to the skin horizontally starting at the umbilicus. So, dito, mag-peppercast po tayo ganun. Scratch. So, the normal liver span is at the MSL is 4 to 8 cm po. So, next to percast is the spleen. So, of course, for detecting splenic enlargement is to percast the last left interspace at the anterior axillary line while the client takes a deep breath. So, sa left po, dito. Can you please take a deep breath, ma'am? Okay, ma'am. So, may isa pang second method nito. So, next is begin to the posterior to the left mid-axillary line and percast downward naman po. Ipe-percast po natin downward and noting the change from lung resonance to splenic dullness. Okay. Can you please deep breath, ma'am? So, her spleen is in a oval area of dullness, approximately naman 7 cm wide near the left tentrive and slightly posterior to the mid-axillary line po. Next naman na gagawin natin is perform blunt percussion on the liver and the kidneys, of course. Palpate and then percuss. Percate and then percuss. So, wala namang masakit, ma'am? Ma'am, may masakit po ba? Dito, ma'am, meron masakit? Okay, wala po. So, no tenderness is alicted. So, it's an inspection, auscultation, and percussion. Now, we were going to palpate. So, of course, we will be palpating the all quadrant. We will be perform light palpation, noting tenderness or masses in all quadrant. So, dapat pag ginagawa po natin ito is dapat naka-gloves po tayo. So, I don't have gloves. So, assuming na naka-gloves po ako, and then, it necessary talaga kung may lesions po yung abdomen ng patient natin. So, ma'am, can you please slide po yung ano nyo? So, I will be performing light palpation in all quadrant. So, masakit po ba, ma'am? Okay. So, her abdomen is non-tender, it is soft, and there is no guarding. So, next to palpate naman is, so, next na gawin ko is deep palpation. The same lang sa ginawa ko, pero ito naman is deep na siya. So, of course, gagamit ako ng dalawang kamay. So, I will use my palmar surface of my fingers and, of course, compress to a maximum depth to 5 to 6 cm and perform by manual palpation if you encounter resistance or to assess deeper structures. So, I will palpate all the quadrant. Masakit po, ma'am? Masakit, ma'am? Okay. Normal tenderness is possible over the xiphoid aorta talaga. Cecum, sigmoid, colon, and ovaries with deep palpation. So, may mga masakit lang na part. Pero overall naman, hindi naman siya nasaktan masyado. So, next to palpate is her umbilicus. So, okay, palpate po natin. So, her umbilicus area and the surrounding area are free of swellings, bulges, or masses naman. Hindi po masakit, ma'am?
Hindi po.
Okay? If I will be palpating her aorta. So, I will use my thumb or my first finger, or I will use 2 hands and palpate deeply in the epigastrium, slightly to the left of midline and assess the pulsation of the abdominal aorta. So, her aorta naman is approximately 2.5 to 3 centimeter wide with a moderately strong regular pulse. Masakit pa ba, ma'am?
Hindi po.
So, hindi. No tenderness. Pero, it is possibly mild naman talaga na may tenderness na ma-elicited po. Elicited. So, next na ipapalpate ko naman is yung liver. I will note consistency and tenderness. So, of course, papalpate ko natin siya. Masakit po ba, ma'am?
Hindi po.
So, hindi ko po mapalpate yung kanyang liver. So, it is normal usually. Although, it may be felt in some thin clients. So, if the lower edge is felt, it should be firm, smooth, and even. So, mild tenderness may be normal. So, medyo masakit po.
Hindi po.
Oh, hindi. Okay. So, dapat inote po natin or sabihin po natin sa patient natin na mag-exhale and inhale. So, ginagawa naman po niya. So, next na gawin ko naman is I will be palpating her spleen. Of course, I will be palpating her skin. Gagamit po na tayo. Yung isang kamay po natin na hindi ginagamit, ilalagay po dito. And then, palpate po natin siya. So, the spleen is seldom palpable at the left costal margin. So, rarely, the tip is palpable in the presence of a low flat diagram or with tip diaphragmatic descent on inspiration. So, if the edge of spleen can be palpated, it should be soft and non-tender. So, masakit po ba, ma'am?
Hindi.
So, hindi masakit. So, I will be palpating her kidneys. So, of course, sa right muna tayo. Palpate po natin yung kidneys niya. So, yung non-dominant hand po natin is assist po natin dito. I will palpate, palpate, palpate. So, next po dito, ipapalpate po natin. Palpate, palpate, palpate. So, her kidneys are usually not palpable naman. Kung mapalpable man to or palpated naman, it should be firm, smooth, and rounded. So, masakit po ba, ma'am?
So, next is to palpate
dito?
the urinary
Okay.
bladder.
So, of course, kagaya ng dati talaga is we will be sabihin natin sa patient na rin mag-exhale and inhale.
So,
para
empty bladder naman is
palpate natin. So,
neither palpable,
overall, hindi naman siya palpable.
nor tender.
So, next is I will be perform the test of shifting dullness if the client has ascites. So, distended abdomen or bulging box. So, perform this special percussion technique. The client should remain supine, of course, supine, and percuss the lungs from the bed upward toward the umbilicus. So, of course, okay, I will be performing. So, can you please side, mom? Side like that. Yeah. So, note the change from dullness to tympani and mark this point. So, ima-mark daw. Gagamit po ng marker, of course. And i-measure. So, okay, now have the client to turn onto the side na. So, next is we will be performing the fluid wave test. So, of course, yung client po natin is dapat i-ganon niya yung kamay niya. Can you please ganyan, ma'am? And then, okay. So, no fluid wave is transmitted naman po. So, next ang gagawin ko po is perform for the ballotment test. Okay, ballotment test. Okay, normal naman. Perform the test naman for the appendicitis. So, first na gagawin po natin is rebound tenderness. Okay? Okay. Yung tip of finger dapat, rebound tenderness. So, no rebound tenderness naman. So, next is Robson sign. Okay, masakit ba? No? So, next is repaired rebound tenderness. Same lang to sa rebound tenderness, pero dalawang kamay ang gagamitin. So, no abdominal pain po ba? So, no abdominal pain is present. So, next is the SOA sign naman. Okay. Okay, hindi naman masakit. Then, the second way is naka-side dapat. Side po, ma'am. Naka-side. Side po, side. Side, ganyan. Then, i-stretch yung isang paa. Okay. Side po. Okay. So, next is the obturator sign. So, pwedeng pagtaas po yung paa. So, wala pong masakit?
Wala po.
Okay, so normal. Wala namang tenderness. Walang pain. Next naman na gagawin natin is the hypersensitivity test. So, of course, kailangan natin ng sharp object. So, I will use ruler. So, kailangan natin siyang i-ano sa abdomen niya. Masakit pa ba, ma'am?
Wala po.
So, okay, the client feels no pain and no exaggerated sensation. So, next naman na gagawin ko is perform the test for the cholecystitis or the Murphy sign. So, of course, press the fingertips under the liver border at the right costal margin and ask the client to inhale deeply. Can you please inhale deeply, madam? Okay. Wala pong pain?
Wala po.
Okay, so no increased pain is present. So lastly is we need to analyze the data, analysis of data. So first is formulate nursing diagnosis, wellness, risk, and actual. And second is formulate collaborative problems. And third is make referrals. Pag may nararamdaman na po siyang iba, if may abdominal pain, of course, yun, kung may sign ng Murphy sign, gano'n, ng appendicitis or cholecystitis. So, dito na po nagtatapos ang aking assessment sa patient ko. So, thank you, ma'am. Thank you dahil po nagpa-assess po kayo.